Come in. Mr. Hassan, nice to meet you.
Nice to meet you too.
I was waiting for you.
Thank you.
Please,
Thank
have a seat.
Thank you for having me there.
So, Mr. Hassan, first, let me introduce myself. I'm Dr. Basim Hamdan. I'm a clinical psychologist. I've been working in this agency for the past 7 years, and today we'll be working here together. So, how are you feeling today, Mr. Hassan?
I'm good, thank you so much.
Good?
Thank you for having me.
Good, good. So, first, I really want to thank you for coming here today because a lot of people find it hard for them to gather themselves and seek for counseling. And you've made it, which is a great thing, so really I appreciate it.
You're welcome.
First, let me talk to you about the process of today's session, but before I start, I see here that you have completed the informed consent.
Yeah, as I've done that before I came here,
Mm-hmm.
I read all the things and obligations and
Yeah.
I confirm it, accepted.
So you understand the rules and obligations of today's session,
Yeah, of course.
like for example, no phone calls or cigarettes.
Yeah.
So and also you understand that today we are going to have around 50 minutes for this session.
That's okay.
During this session, we're going to have an intake session actually, which means data collecting. But before I talk about it, I have to talk about an important thing, which is confidentiality, or in other words, it's called privacy. So let's make it clear that everything that we are going to talk or discuss, or even notes that I'm going to write, is going to be under confidentiality.
Okay.
No one has access to these information but me and you.
Okay.
But you have to understand also that there are some exceptions for this confidentiality where I have to break it. So one of the important exceptions is that if you directly ask me to break this confidentiality, for example, for your own physician or something, I would give information for them. Another exception you have to understand is that if the court asked me for information, if you have any federal issues, any problems, they might ask me for information about your condition. In this case, I am required to break the confidentiality and give them these informations. Another important exception is that, as you know, in this agency, there are other workers here that try to take care of our clients. So, for example, our director, or let me give, for example, the bill maker might be interested in some information about you. For example, the payment method or your insurance type. But I'm not going to tell them about your secrets or the problems that you're having or the things that you're sharing with me in this session. Is that clear?
Yeah, this is
Yeah. The last important exception I want to talk to you about is if you are attempting to harm yourself or anyone else. So, for example, if you are trying to commit suicide or homicidal attempts, or trying to harm anyone else, I'm going to maybe I would call the police or contact with the person to have the required actions. But is that clear?
yeah.
Yeah, I just want to tell you that these cases are rare and not
Yeah.
every time it happens, but I have to give you information so you can understand it. Is that clear?
That's fine. No
Yeah.
problem.
Do you have any questions about that?
Thank you.
So without further ado, let me tell you about the intake session, which we are doing today. Today I'm going to collect information from you. In other words, I'm going to fill this note that you have here with information that you're going to provide me. So today I'm going to be talking a lot than usual.
That's fine.
Yeah, because I'm going to ask you a lot of questions in different domains of your life, of your of the aspect of different domains of your life. I hope that you don't feel bad or feel uncomfortable, and if you feel uncomfortable at any part of this session, you are free to stop it and go out or quit. And also, you can at any time tell me that you don't want to discuss this issue at this time, and we can discuss it later. Is that okay?
It's okay.
Okay, good. So let me start with. Can you tell me more about yourself, Mr. Hassan? Like describe yourself for me.
Okay. Actually, my name, as you I've told you, my name is Hassan.
Mm-hmm.
I came from Iraq, like to here,
Yeah.
5 years ago. Right now, I'm living alone in a flat,
Yeah.
alone, and I'm a medical student.
Medical student.
Yeah, here in Turkey.
In Turkey. Yeah.
Yeah.
Anything else you want to talk about?
Actually, I came alone, and at the time I came, I lived with my friends in a house. We were
Yeah.
five. We were mixed as a group.
Okay.
Yeah, we were 5 people, and actually at the time we stayed together. Like there's some problem become to happen and something like that. So I was kind of decided to go to live alone.
And decided to live alone, right?
Yeah,
So you're saying that you and how old are you again, Mr. Hassan?
I'm 25.
25.
Yeah.
So you're saying that you came here 5 years ago with your friends, but because of some problems, you started to live alone.
I came alone, and
Ah.
here I made those friends, and we become kind of housemates. Like they are not my friends, we are
yeah,
house.
flatmates.
Exactly.
Yeah.
Yeah.
So, Mr. Hassan, what brings you here today?
Okay. Actually, for 9 months, I used to have a cat.
Mm-hmm.
Its name is Psycho.
Mm.
Yeah.
May I ask why did you call it Psycho?
Yeah, of course. Actually, I feel it's explained my situation.
Yeah.
Yeah, so I put the name for a reason.
Yeah.
It stayed with me 9 months, but after that, I figured out that I have allergy for a cat, for animal as a general, for a dogs,
Yeah.
for a cat, and I was enforced to leave it.
So, from what I understand, for the past 9 months you had a cat, but because of a medical condition like allergy, you had to leave it
Okay,
from you, right?
that's exactly. After I left it,
Mm-hmm.
I started to feel like, let's say, lonely, like
You start to feel you are alone, right?
exactly because, as I've mentioned, as the time that I put this name Psycho, I told it for a reason.
Yeah.
So because I've feeling something missed, I feel like I have some problem to be connect with people, because the reason when I leave the group which I lived with them, these 5
Uh-huh.
people, because of problems
Yeah.
we couldn't be together for more
And
time.
you feel like the cat filled this gap, let me say, about
Exactly,
between the connection.
exactly. I consider it as a thing. This creature gave me what other couldn't give it to me.
So you consider it as a friend more than just
More
a
than,
friend, right?
more than. Like it's my housemate, it's my
Mhm.
friend. It's the one who watches movies with me at night.
Yeah.
Yeah, like maybe gonna laugh or gonna smile. And what's like gonna say.
No, it's okay.
Yeah.
It's normal for people.
But actually, as the time when I'm sitting on my sofa and watching movie, it just came to beside me and watch. I feel that like
yeah, it's normal actually for people, especially in this country,
yeah.
that are living alone to have good connection with pets. They feel they are connected to them and feel fulfilled when they are having them.
Correct.
So I understand that leaving this creature, which is apart from your life, caused you some issues.
It does.
Is that right?
Yeah.
How did you feel when you left that
Actually,
cycle?
yeah. By the way, he's a Maya. Like his name is Psycho.
Mm-hmm.
Yeah. So I feel really, I feel like there's a huge part of my life being missed.
Yeah.
As you mentioned, really, it was a good word. A huge gap
Yeah.
happened to me. Because everything I've done before with him, Psycho, with
Yeah.
the cat, right now I'm doing alone.
You're doing alone, and
Yeah,
you're
by
feeling
myself.
something is let me
Missed.
say missed, right?
Yeah, yeah.
Yeah.
This, as the time when I'm doing something alone, I feel okay. This is not the same fun, the same happiness that I'm taking while I'm doing these things at the time when I was with the cat.
And you're feeling down because of this?
Of course, there is symptoms happening to me after that. Like I feel everything is without taste. Like
Mhm.
I feel like exactly I've been missed the taste of life.
So you're saying is, from what I understand, is that because of the medical condition you had to leave a good friend, which is the pet that you had, and because of that, you're feeling a bad feeling. Let me say you're feeling alone. You're feeling that you are not having fun in this life as you used to have. Is
Yeah.
that what I'm trying to say?
Exactly.
Okay, we are going to talk about this more during this session later, but first have let me ask you some questions that are called symptoms check. So in this list, I'm going to tell you some of the symptoms that are generally happening to people. It might not be applying to you,
Okay.
so if you feel uncomfortable of any of them, just I'm not trying to judge you here. I'm just trying to help you, and if you have anything to say about it, I'm going to be listening to you.
Okay.
Okay.
It's fine.
So let me start with memory loss. Have you had any memory loss before in your life?
Actually, I have had memory loss, but after a time, gradually, let's say I solved this problem.
Can you be more specific and tell me when did that happen? Do you
Okay.
have any information about that?
I feel like I start to forget some big occasions, let's say, like important occasions.
Mm-hmm.
But after time, I said I solved it by putting that occasion related to some another thing happened to me.
So you feel like you are like disconnected from the event and you are in a different event?
Yeah, yeah. So I solve it by this way, like to put it to another event,
Mm-hmm.
and at the time to want to remember this event, I remember the other events. I remember the both.
So you mix them or you
I mix them.
forget one of them and try to let me say create a different event?
Yeah, yeah. The other events already exist, but in order to remember the first event, I related with the second event.
Mm-hmm. It's okay. I understand.
Actually,
that.
some people, let me say that, told me like this, you're gonna miss the both of events, and he told me that's why I said okay, but it works with me, so
Mhm.
that's why I'm keep doing that.
I understand.
Yeah.
Can you tell me when was the last time you had this issue or felt that you have this problem?
The memory
The
loss.
memory loss.
Actually, after I left Psycho, after I left
So-
the cat.
Like before like how many months? 2 months? 3 months from now?
2.5 months, 3
So-
months. Yeah.
After 2.5 or 3 months,
Yeah, something
you
like that.
started to feel like you cannot connect directly to an
Exactly.
event,
Exactly.
and because of that you mix an event with another. Is that what you're trying to say?
Exactly.
Mhm.
In order to remember the one which I was searching for.
Mhm. But you will remember it with mixed information. Is that what you're trying to say?
Yeah. It's
Mhm. We're gonna be discussing this in more details
okay.
in the next session.
Okay.
For now, I want to ask you, do you have any substance issues, like for example, drugs, weeds, anything like that?
No.
You don't use
No.
them at all? In the previous one?
Smoking maybe.
You smoke?
Yeah.
Since when are you smoking?
2 years, something like that.
Mhm. What about drinking? Do you drink alcohol?
I'm like considered as social drinking. Like.
So like from time to time?
Yeah, exactly.
When was the last time you drank? You used
Like
alcohol?
maybe 6 months ago, something.
6. What about hallucinations? Do you feel like you listen or see any sounds or visuals that are not existing?
Sometimes I've heard the mewing of my cat.
The sound of
The
your
sound
cat,
of my
right?
cat. Like I feel so one day I was sitting on here watching some program on the movie
Yeah.
on the TV. I've heard something like the cat in the other room. I just opened the room, the
And
door.
you didn't find it, right?
Yeah,
So this one also started when you left
yeah,
Cycle?
of course.
Uh, what about your feelings? Let me ask you, like, how do you describe your feelings? Do they go from one extreme to another? Like, for example, do you feel like for one day you are happy and the other day you are sad, or is it stable?
Actually, it's kind of it's stable.
Stable.
Full sadness after leaving cycle.
So you describe it as stable and
Stable for sadness.
yeah.
Yeah.
What about irritability? Are you irritated from easily, for let me say, from things that you are having in your day?
No.
You're not irritated. I want to ask you about sleeping troubles. Do you have any sleeping troubles, like sleep more or sleep less, or do you describe it as normal?
Sleeping more?
You're starting to sleep more.
Yeah.
Have you had this issue before or after this event?
Let me say that like I've considering sleeping more as a way from escaping from the time from the hours of being
Mhm.
alone. So much more hours going by sleeping.
So you're saying that you are using sleeping as a way to run away from the problem, which is feeling alone. Is that
Yeah.
right?
Yeah. So I'm saying maybe it's going to go by
Mhm.
sleeping, but just let it go. Like
Yeah.
say,
And do you feel like that might be working for you?
let's say if you're gonna give it a percentage, it's gonna work for 45-50% for me.
Mm-hmm. What about nightmares? Do you have nightmares?
Actually, yeah, I think it's
Like
normally.
normal?
Normal.
Yeah, like
Before
how do you
I-
describe it?
Yeah. Do you want me to explain my
Please, you
nightmares?
can explain it whatever you want if you feel comfortable about explaining it.
Actually, I don't think if it considers a nightmare or something. Recently, let me tell you the last thing that last my nightmare. Maybe others not considering that as a nightmare.
Mhm.
I see my father smoking,
Hmm.
and my father has not done that before.
And you've never been smoking before.
Yeah, he's a doctor by the way.
Hmm.
Yeah, he's a cardiologist.
We're gonna be talking about
Yeah.
your family
Yeah.
in the next sections. Mr. Hassan, do you believe that you have any obsessive thoughts or any compulsive behaviors? Like, for example, do you feel like you have to clean your hand or wash it all the time because of any contaminations, or do you have to close the door to check it, or any of these?
Maybe I had something of searching for something always.
Searching for something?
Yeah, which is actually after that I'm saying like what I'm looking for, like, and in my house like just sitting and something in a moment just looking for something. Let me say maybe I was looking for the cat
Hmm.
which I've lost.
Can you describe this a little bit more? Like, how does that happen? Like, what are the things that you are looking for, and how, like, are you doing this all the time? Like, do you feel like you have to look for something?
As I have told you, like sometimes I've heard the sound of my cat.
Mm-hmm.
So after I'm just checking what the sounds like where it does coming from,
Yeah.
I'm finding nothing. So sometimes I'm saying, okay, maybe the cat which I lived, which I've left, maybe it came back from my home.
Yeah.
So I'm starting for searching, looking up for it.
And do you
Nothing.
think that, let me say, this behavior is disturbing your life? Like it's taking a lot of effort and time from you?
Uh, Let me say that I'm feeling that's something gonna happen. Like my cat one day gonna come back for me. So I'm always like the one who I'm a waiter. So the waiter gonna looking up, gonna search
He's
for what
gonna
he
be
is.
looking up for what he is waiting
Yeah.
for.
That's
Is that what you describe yourself as?
Yeah.
Interesting. How about any problems with food, like the amount that you're consuming? Do you feel like it's normal, more or less?
Okay, we came to let's say it's some important point for me because as I've told you, I'm spending the hours of my day by
Mhm.
sleeping.
Yeah.
The other hours I'm spending by eating. Yeah,
So you say that you are consuming food a lot.
it is considered maybe.
Is that recently happening because also from the cat loss?
Okay. I've used when Psycho was with me. We used to eat together.
Yeah.
So the amount we've used to for two person, let's say Psycho is
Yeah.
a soul. Put the same amount again
And you're eating it by yourself?
by myself because I'm considering him as existing in my home.
Mr. Hassan, do you feel like you have been a danger to someone or to yourself? Like, have you had any, let me say, suicidal thoughts or homicidal thoughts, like harming yourself or anyone else?
No, but sometimes I feel guilty because the reason of leaving the cat was my health condition. Like, it was me. Not suicide or something like
Mhm.
that, but just taking the guilty.
So you're feeling that you are responsible for
Responsible.
this, and that makes you, for example, wanna hurt yourself, punish yourself.
No, but like because I had two reasons. I had two options, even the cat or my health.
And you have to choose one of them.
Yeah. So I feel guilty because I choose the cat, not my health. Why not? I didn't choose my health. Like just put the cat and keep sneezing and coughing.
But you choose the rational
Yeah. Yeah.
choice, right? Which is your health.
Otherwise, that's something which I love.
What about, let me say, have you ever been violent to someone? You didn't talk to me about this section. Like, you talked about not trying to harm yourself, but you didn't talk about others.
Actually, let me remember for a second. I don't think, but yeah. Some one day, like I'm about to take the bus, and the driver of the bus, sorry,
Yeah.
was saying, "Hurry up, hurry up, hurry up," and I was, why is like shouting? Like I'm already gonna take the bus. I'm gonna go
Yeah.
inside. So I told, okay, I'm already hurrying up. I'm coming. So he's like, why are you shouting? You're the one who was shouting. And he started to say something like saying blah blah garbage, something like that.
You start to say bad words, and then
Yeah, and they say know your limit, I know your border, like
Mhm.
I told him. And I just left the bus and they didn't take it.
so, from what I understand, is that you didn't have any, let me say, physical or using bad words with anyone, but just some accidents or incidents. Is
Access
that
for
what
a
you're saying?
reason, for a reason. My thought, for a reason.
Thank you, Mr. Hassan, for completing this section.
Okay.
If you want, you can have some water.
Okay.
Yeah. Now, you're actually doing a great job here. We're going to move to the next section.
Okay.
It might be hard for you, but please try to give me uh, good answers so that I can help you. We're going to talk about trauma scanning. So I'm going to ask you if you have or believe that you have any trauma or traumatic events during your life. You mentioned that you have recently, let me say, lost your cat. But do you have anything else like a loss of beloved one or close friends or any vehicle accidents, for example?
Actually, that was happening. I was driving
Mm-hmm.
a car which I rented. While I was driving, like a cat, like
Mm-hmm.
became down from the sky in front of the car, and I
Yeah.
was to turn left in order to not, because I have some, like I saw a cycle in front of me while I was
So
driving.
you saw things.
It was a cat.
You saw a cat or a real cat? It was.
It was a real cat, but I don't know how it comes in front of me.
Mm-hmm.
In a way, like it's in front of me, so I had to go right, and I made a car accident.
And have you had any physical damage from this?
No, only
accident?
my head pushed the steering, and
Do you think that this one was a traumatic event that you couldn't recover from?
actually I have a fear, afraid, like of driving the car again.
So you're saying that, then correct me if I'm wrong, because of this accident you are starting to use the bus and public
Exactly.
transportations?
Yeah,
So you have a fear from cars.
yeah. I'm afraid of the cats coming in front of me. I'm gonna kill it by.
You're feeling, you, let me say, afraid from being guilty from killing
Yeah.
or hurting another
Yeah.
person or soul.
Because I've started feeling that every cat is a psycho.
Mm.
That's why this feeling is really, maybe it has two sides for me, like loving all the cat,
Yeah.
but another way I cannot being close to them. So loving by
What hurts you?
yeah, you
Mm.
can't do nothing just looking for them. For me, it is not
And
enough.
you became obsessed with looking for cats. Let me like.
Yeah.
Whenever you go, you try to see if there
Yeah.
are cats or not.
But at the time which cat's closer to me, I want to hang it and like it's cat, it's
Mhm.
nice soul.
You feel fluffy and you wanna
Yeah,
have fun with it, but you can't.
I'm forbidden for doing that.
It's forbidden.
Yeah.
Mr. Hassan, have you had any physical or sexual abuse in your life?
No, actually
No.
no.
What about, for example, domestic violence in your house?
No.
You have not any.
No.
Okay. Let's move. Let me move to another section, which is substance abuse.
Yeah.
Yeah. So you mentioned that you have never used any, let me say, drugs or weeds, but you are smoking.
Yeah.
Is that right? Can you tell me more about how did you start smoking and why are you using it? Are you using it as a way to relieve yourself from something?
Sorry, actually, I started smoking for, let me say, I told you at the time I came to Turkey, I lived with a group of people.
Yeah.
One of them was, like, let me say, closer than the others for me.
Mm-hmm.
He's a friend. And he was smoking. So I was just like take shot, like, smoke with him. Like,
Yeah.
even I didn't know how the correct way of smoking. I just put it on without no meaning, like. But and I was regular smoking, like, let me say 2 or 3 cigarettes a week,
Yeah.
or maybe less. But after as usual, after I lost my cat, I started to smoke 1 packet a day, like 20 cigarettes a day.
So let me get this clear. You said that you have started smoking like 5 years ago when you were 20,
Yeah.
and it was you're consuming a small amount, let me say,
Of course.
and after the loss of the cat, you have started to use it more.
Exactly.
Let me get this clear. Are you using it as a way to calm yourself or to, let me say, reduce an emotion that you're having?
Maybe the second thing, reduce that
Reducing an emotion,
Yeah.
like what type of emotion? Let me give you, for example, sadness or guilt.
Missing something that I love.
Hmm. Do you want to take a break for now? Because we've been talking a lot. Do you feel
Yeah.
like you want to take a break, or
It's
it's
okay.
okay for me to
Let's
continue?
take a break.
Let's take a break
Yeah.
for like 1 or 2 minutes.
Oh, okay.